So this collaborative will focus on, but not be limited to, 5 major objectives. So first, and I've had an upfront view to a lot of this, unfortunately, in my cancer care, and also having the privilege of talking to a lot of great doctors who have come up and have voiced concerns and ideas on how we can do things differently. But first, obtaining better situational awareness for the current cancer rates and reoccurrent rates. Currently, there is about a 2-year lag between the time that data is collected, submitted, and analyzed, if at all, and we know that that's clearly not good enough. We need real-time data to assess current trends and act as quickly as possible to address concerns. For example, why are so many types of cancer skewing younger and becoming more prevalent? Case in point, why are there increasing concerns recently from some physicians about higher rates of reoccurrence? To move quickly in our fight, we need a better data collaborative across Florida, across healthcare systems, to quickly analyze that data, not waiting for months, for years, for systems to hopefully report back and paint an outdated picture of the situation. And this requires healthcare entities to agree to work beyond the walls of their institution, to share real-time stats to collectively address concerns. And this data collaborative will not only look at diagnosis rates, but also treatment protocols, success rates, to be able to further innovation and best practices. So to that end, second, we also ask this collaborative to investigate and recommend best practices currently in use, not only in Florida, but across the country, and work to bring those solutions to healthcare systems across the state. Why, if a physician has been utilizing a proven technique within their hospital system for years, and that successful procedure is not available to other patients across the state, if not, why not? What reasons or barriers to entry are prohibiting successful practices from being made available to Floridians? Is it bureaucracy? Is it the lack of a billing code that allows for reimbursement, which in turn allows physicians to receive just compensations for their talent and thus incentivizes other physicians to train in that area of expertise, which then opens up that successful practice to benefit more people? We owe it to Floridians and their families to do everything that we can to cut the red tape. And speaking of red tape, something that we don't like very much in Florida, what barriers exist to novel technologies and new treatments and procedures to expeditiously but also safely enter protocols? What is the path to some of these innovations, especially in the area of prevention? Make it from research to trials to ultimately mainstream to make these covered by insurance. If it's a bureaucratic, unaccountable entity that delays or prevents help and hope to people of the state, we need to better understand why. How does one treatment get the reimbursement green light while others may not? And that brings us to a very important component of the Cancer Connect Collaborative, and that is the funding. The governor and his budget has been a champion for cancer in the fight against cancer, recommending nearly $170 million in this year's fiscal budget, which is $20 million more than last year's historic budget investment of $149 million. But let's take a look at how that money is being spent. On behalf of the Florida taxpayer, we thank Florida's National Cancer Institutes for their partnership, and we look forward to having this group see how those funds have benefited Floridians. But we also ask this collaborative to look at new options to fund research and solutions to other research entities and hospitals, including non-NCI facilities, where the majority of cancers are treated every year across the state. With respect and where it applies, we asked healthcare systems to look past profit models and competitive advantages, to tear down their walls and unite in a common mission to save lives. And lastly, when it comes to saving lives, what can we do? What can I do as a Floridian to best make decisions to hopefully ward off a cancer diagnosis? With respect, it's not good enough anymore to hear we don't know what causes cancer. We do know a lot of what causes cancer. And frankly, I would like that information laid out in a straightforward manner, free from tainted influences. I'd rather not rely on content and random articles brought to you by a special interest that may be, unfortunately, a part of the problem. Through this collaborative, we need to empower Floridians with the most accurate, up-to-date information so that we can make better positions to put ourselves and our families in the driver's seat to hopefully prevent or catch a cancer diagnosis early. At the end of the day, we really hope that this collaborative looks at this moment in time as an opportunity to reanalyze and rethink the way that we approach cancer care in the state of Florida. As somebody who has personally lived through hell, I cannot thank this collaborative enough for your service, for your time and your unwavering commitment to find solutions to ultimately saving lives and giving people like me hope.